One of my areas of interest, let me just share this with you. One of my areas of interest is my experience. I've been focused on breast cancer for 27 years.
Mm-hmm.
And many of my patients have said a couple of things to me. One is, my life is forever changed, no matter what.
Yeah, there's a new normal.
Yeah, there's a new normal, and
Whatever
it's
that
not
is.
the old normal,
Right.
particularly for husbands and people who think, well, you're all done with that, let's just get back to our normal life, right?
Exactly.
It never happens. And number two, sort of this feeling of, it's like running the Boston Marathon. You finish the race of the initial diagnosis, various aspects of treatment, surgery, chemotherapy, radiation therapy, reconstruction. Sometimes it's a year out after you're done with all this. And it's sort of like finishing the race, and you're looking around and now what?
Right.
You know, where are all those appointments that I had, and all those doctors and nurses and navigators?
Exactly.
I think I agree with all the issues you listed, but I also think there's an issue of assisting people with that aspect of their life too. What are your thoughts about that?
I was asked by Dr. Singletary years ago with another survivor and a nurse practitioner to write a chapter on survivorship. And there is this, the umbilical cord has been severed, and everybody around you, for the most part, wants you to be back to being the mom,
Right.
walking the dog, taking the garbage out, whatever it is. I mean, kids to school, all those things have to fall back into place. And yet, emotionally, physically, you might be there. Your hair's grown in, your reconstruction is healed, all those things have healed, but the emotional aspect is still, 18 years later, I still have issues that will come up. And that's, I think, where it used to be, you know, we worry about saving you. And then they saw, wait, we've got to start looking at prevention. I think now there's got to be a shift to looking at survivorship issues, and it's stages out. My issues at 18 years out are quite different from 18 months out.
That is exactly
And
correct.
so
Yeah.
it's getting some focus, and of course with focus you need dollars. So getting funding to look at survivorship issues.
One of the people we had on here, I guess it was yesterday, has organized an incredible program at the University of Kansas.
Yes, and I met her through Dr. Kirchman.
Yes, exactly. Michael.
Deborah.
I've decided, Todd, that Michael is our main focus of the most interesting people on the planet.
She was at dinner with us, yes.
Yeah,
and
yeah.
she has,
Yes,
yes,
Right.
and she has quite a robust survivorship plan going.
Goodness. I told her she's just become one of my new best friends. And before you get out of here, I need to know how to get a hold of you too.
I will.
All right?
I have that
because I do want to follow up. I live in Southern California, but as I look at next level of focus in my career, it's going to be on the things that we're talking about here today.
Well, and I think everybody's going to have to wake up here, because there is going to be a mandate in 2015. Survivorship plans have to happen, and what do those look like and how they're going to roll out? I think institutions need to be focusing, you know, and I know dollars are short, but that day's coming, and you certainly don't want to be worrying about that in the fourth quarter of 2014 and thinking, oh my gosh, we have to have a survivorship plan.
Yep.
Because you've got to ramp up to what a good survivorship program looks like.